Welcome back, guys, to this discussion on pathology. Today we are going to discuss this very important topic, that is inflammation. Very important, but most important discussion in pathology. So let's start. Okay, inflammation. First, we are going to see the definition of inflammation. Okay, the definition is the inflammation is a response of vascularized connective tissue. So response of the vascularized connective tissue to injurious stimuli. Okay, it is a response of the vascularized connective tissues to injurious stimuli. There are three parts to this definition. There is a response. We are going to see the processes of inflammation. The vascularized connective tissue, we are going to see the parts and regions and what happens where. Then there is injurious stimuli. So let's start with the injurious stimuli. Okay, injurious stimuli. So what are these injurious stimuli? So injurious stimuli include infections, most important stimuli, infections. Then there are immune reactions. Okay, immune reactions. Then there is some foreign bodies. There are some foreign bodies. Then there is tissue injury. Okay, out of these, the all important are infections and tissue injury. Also, immune reactions and foreign body presence causes inflammation. Okay, I'm going to see types of inflammation. Okay, types. Okay, first is acute inflammation. Okay, second is chronic inflammation. There is acute inflammation and chronic inflammation. So we are going to first in this model we are going to discuss is acute inflammation. First is acute inflammation. Before starting this discussion of acute inflammation, I want to see some features of inflammation. Okay, features of inflammation. Quickly, we are going to see some features of inflammation. First is rubor, RUBOR. Then there is tumor. Okay, third one is calor. Fourth one is dollar. Okay, rubor, R for R means redness. This is one. Tumor means swelling, generalized swelling. Calor from calorie, which is for heat. And dollar is for painfulness. Okay, there is redness, swelling, heat generation and painfulness in the area, which are the inflammation. These four are called, remember, cardinal signs of inflammation. Cardinal signs of inflammation. Okay, this was given by, remember, Celsus. The Celsus, the cardinal signs of inflammation: rubor, tumor, calor and dollar. Then this guy Virchow, okay, this important guy Virchow, this he added fifth sign of inflammation. Okay, fifth sign of inflammation called functio Lysa, which means loss of function of the concerned organ. Okay, so there are now 5 signs of inflammation: redness, swelling, heat, painfulness, and loss of function of the concerned organ. Virchow added the 5th sign of inflammation. 4 cardinal signs were given by Celsus. So we're going to see, first we're going to see briefly the mechanism of acute inflammation. Okay, mechanism of acute inflammation. Okay, now we're going to draw a blood vessel for this. Okay, see, this is a blood vessel. We all know these are the what, epithelial cells. Okay, sorry, these are the epithelial cells. Okay, in the blood vessels. Now here, so in this central periphery, okay, here is the central region and this is the peripheral region. Okay, this is the peripheral region. Okay, in the central region, okay, there is RBC in center of vessel. There is RBC in the center of the vessel. Okay, now in the periphery there is leukocytes in the periphery. First important concept to understand: RBC in the center of the vessel, which pushes the leukocytes in the periphery. Okay, important fact to remember here: these are the endothelial cells. The marker for them is CD34. The universal marker for endothelium or endothelial cell is CD34. Okay, and as the leukocytes are pushed to the periphery, okay, the leukocytes consist primarily of, okay, remember, neutrophils. Okay, neutrophils. Now while at this periphery, okay, so I'm going to see here, now this is the site of injury. Okay, this is the blood vessel, this is the site of injury. The neutrophils needs to come from this blood vessel to the site of injury. Okay, neutrophils needs to cross this barrier of endothelial cells and come to this site of injury. Neutrophils needs to do this. Okay, and cause the phagocytosis. Okay, this is the entire gist of acute inflammation. There is a blood flow here. The RBCs are present in the center and the leukocytes are pushed to the periphery. Of this, the most important are the neutrophils. These neutrophils needs to cross this barrier of blood vessel and the endothelial cells to the site of injury, because their most important function, that is phagocytosis. And the marker for the endothelial cells, remember, is CD34. Okay, now we are going to see the steps. This is the gist of mechanism of acute inflammation. Now the steps. Okay, steps. Of these steps, there are 2 types of events. First event is vascular event. Okay, first event is vascular event. So we are going to see only the names, and afterwards we are going to discuss how and what are the mediators of the events. First, vascular event. There is early transient vasoconstriction, early transient vasoconstriction, which is then followed by vasodilation. Early transient vasoconstriction followed by vasodilation, which leads to increased vascular permeability. Which is then followed by the final vascular event, which is stasis of blood flow. That is stasis of blood flow. Okay, now here some points. So early transient vasoconstriction is the lasts for few seconds. Okay, this is the earliest event in acute inflammation. This is the earliest event. Okay, lasts for few seconds, and this increased vascular permeability, very very important. This is the hallmark of acute inflammation. Okay, this is the hallmark, which increased vascular permeability, very very important hallmark of acute inflammation. Okay, early transient vasoconstriction followed by vasodilation, increased vascular permeability, and stasis of blood flow. These are the vascular events. Next type of event we are going to discuss is cellular events. Okay, cellular events. Okay, so bit long one, so follow with me. We are going to see only the names and further discuss in details how the steps occurs. Okay, the first one is margination. Okay, second one is, remember, rolling. Okay, followed by adhesion. Margination, rolling, followed by adhesion. Then there is, remember, transmigration. Okay, which is followed by chemotaxis. Okay, chemotaxis, followed by this important opsonization, the penultimate step, opsonization, and the ultimate cellular event is phagocytosis. Okay, phagocytosis. So here comes the MRA TCOP. Okay, there is no specific mnemonic here, just have developed this. This is MRA TCOP. Okay, margination, remember, margination, not migration. So very common mistake we do. This is M for margination, R for rolling, then there is adhesion, then there is transmigration, this step here, this transmigration. Okay, then there is chemotaxis, then there is penultimate step before phagocytosis, opsonization, and finally the ultimate purpose of the neutrophils, phagocytosis. MRA TCOP. So these are the vascular events and cellular events in gist of acute inflammation. Now we are going to see in details, in depth of all these events. Okay, let's start with vascular events. Okay, first event is transient vasoconstriction. Okay, transient vasoconstriction is for few seconds. You all know this. It's followed by vasodilation. Okay, this vasodilation, remember, this usually involves arterioles. Okay, this usually involves arterioles. This vasodilation is, remember, mediated by histamine. Mediated by histamine. Here there is, as there is vasodilation, there is increased blood flow, which leads to redness, which is our rubor. This redness leads to heat generation, that is our calor. The blood vessels dilate, which leads to increased blood flow, which leads to redness and heat, which are our rubor and calor. The dilation which involves the arterioles and mediated by histamine. Very important point to remember here, mediated by histamine. Okay. Following vasodilation, we have got our third step here, the hallmark, that is increased vascular permeability. Increased vascular permeability. Here it usually affects the venules. Usually affects the venules. Here it involves the arterioles. Here it affects the venules. One major difference here. Next, it is also mediated by histamine. Okay, mediated by histamine. This is the hallmark or most important step. Most important step of acute inflammation. Okay, hallmark or most important step of acute inflammation. Here occurs due to increased vascular permeability, leakage of proteins and fluids to outside. What do you mean by outside? To the interstitial spaces, not to outside of the body, from vascular tissues, from vasculature to outside. Okay, there is leakage of proteins and fluids to outside, which leads to swelling of the site. What we call this swelling as tumor. One of the cardinal signs, swelling of the site as tumor. And this protein rich fluid is called as exudate. This protein rich fluid is called as exudate. Okay, I'm going to see a very small discussion on the difference between an exudate and transudate. Okay, exudate and transudate. Okay, for exudate there is a specific gravity. The density is always greater than 1.020. Here the specific gravity is less than 1.020. Okay, this occurs in inflammatory edema. Okay, this occurs in non-inflammatory edema. Non-inflammatory edema. Okay, third difference is this is rich in proteins and cells. Okay, as you have seen here, this leakage of proteins and fluids to outside leads to formation of exudate. Exudate is rich in proteins and cells. This is poor in proteins and cells. Okay, last difference is there is high levels of LDH, low density LDL, low density lipoprotein, and here there is less LDL. One of the important difference between exudate and transudate. Okay, exudate occurs in inflammatory edema and transudate occurs in non-inflammatory edema. Next, moving on, we've seen the steps here. The increased vascular permeability. So we are going to see some mechanisms of increased vascular permeability. Mechanism of increased vascular permeability. Okay. First is there is endothelial cell contraction. Okay, endothelial cell contraction or retraction or formation of endothelial gaps. Okay, endothelial cell contraction or retraction or formation of endothelial gaps. This usually affects the post capillary venules. Post capillary venules are generally affected. Here these are mediated by histamine or, remember, leukotrienes. Histamine or leukotrienes. These are responsible for immediate, transient response. Responsible for immediate, transient response. Okay, endothelial cell contraction or retraction or formation of endothelial gaps. And the next second mechanism is direct endothelial injury. Direct endothelial injury is direct endothelial injury. Okay. Another mechanism could be leukocyte mediated endothelial injury. Okay, leukocyte mediated endothelial injury. And one of the last mechanisms could be increased transcytosis. Transcytosis due to formation of tunnels. Okay, due to formation of tunnels, there is increased transcytosis. Okay, these are some of the mechanisms of increased vascular permeability: direct endothelial injury, leukocyte mediated endothelial injury, increased transcytosis, and endothelial cell contraction. This one is the most important of all. Okay, this is most frequently asked everywhere. Most common: endothelial cell contraction or retraction or endothelial gaps formation. Okay, moving on, this was the third step of vascular events. The fourth step is stasis. In the stasis, this is slowing of blood flow. Okay, slowing of blood flow. So how this occurs? Let's see this. So this is the blood vessel. Okay, the fluids are out. We have seen due to increased vascular permeability, the fluids are out. Okay, here they are RBCs. Okay, the RBCs starts accumulating inside. The RBCs start accumulating inside. This causes hyperviscosity of blood. This causes hyperviscosity of blood. Why the RBC starts accumulating inside? So hyperviscosity of blood. This leads to stasis or slowing of the blood flow as the fluids are route rich with proteins and cells. Okay, this was all about the vascular events. Okay, the next thing I will discuss obviously is the cellular events. Okay, cellular events. Remember MRA TCOP. Okay, first event here is, remember, margination. Okay, excuse me. First step here is margination. Okay, is also called pavementing. This margination process also called pavementing. It's a process of redistribution of leukocytes, okay, to the margin. Okay, the process of redistribution of leukocytes to the margin. Above we have seen RBCs are in the center and leukocytes are pushed to the margin. Okay, this is the process of margination of pavementing, followed by second process, R for rolling. Cells quite literally roll. Okay, the leukocytes starts rolling over the endothelium. Leukocyte starts rolling over the endothelium. There occurs, what do you mean by this? There occurs loose attachments to endothelium. There are loose attachments to endothelium. Okay, so this is the blood vessel and these are the endothelial cells. So these are the leukocytes. Okay, these are the leukocytes. They form transient relations, loose attachments to endothelium, and this appear as if they are rolling over the endothelial cells, form loose attachments to the endothelium. An important point, these are mediated by compounds or molecules called selectins. Okay, called selectins. Selectins are for rolling purpose. Selectins are of three types, remember. E-selectin, okay, then there is P-selectin, then there is L-selectin. Okay, EPL, English Premier League, E-selectin, P-selectin and L-selectin. E-selectin, E, and E stands for, remember, endothelium. It is on the endothelium. P-selectin is for, remember, platelets and also for endothelium. Okay, L-selectin is for leukocytes. Okay, remember this endothelium, E and P will be used very much afterwards. Okay, L-selectin is for leukocytes. Okay, so to see the process of this rolling. Okay, so there is this, first there is this leukocyte. Okay, sorry, there is this leukocyte. Okay, multinucleated structure it has. Here is a leukocyte. Okay, and here is our endothelium. Okay, endothelium with endothelial cells. Here is our endothelium. Okay, E-selectin and P-selectin I've said on endothelium, so these are on endothelium. E and P. Okay, L-selectin is on leukocytes. Here it is L-selectin. Okay, L-selectin is on leukocyte. Okay, then moving forward, here on the endothelium, okay, this molecule called glycam 1, also CD34. CD34, the universal marker for endothelium, along with this glycam 1. Then this L-selectin interacts with glycam 1 and CD34. Okay, interacts with glycam 1 and CD34. And what is left for E and P selectin to interact? Very good question. Here on the leukocytes, okay, remember there is this molecule. This molecule is called Cialyl-Lewis X. Okay, Cialyl-Lewis X modified glycoprotein. Cialyl-Lewis X modified glycoprotein, where on the leukocytes. Okay, E-selectin and P-selectin interacts with this molecule of Cialyl-Lewis modified glycoprotein on leukocytes. Okay, that's why I've said to remember E and P selectin are on the endothelium. This is the reason for their interaction and how this entire process of rolling goes on into action. Process of rolling goes to action. Selectins are the molecules that helps in this process. Okay, next, moving on, this is some important points here. The expression of selectins, okay, induced by this expression of selectins is induced by, remember, interleukin 1 and tumor necrosis factor TNF. Interleukin 1 and TNF, tumor necrosis factor, responsible for expression of selectins. Okay, next is, there are these some small bodies here in the endothelial cells. Okay, these small bodies are called, remember, Weibel pallid bodies. Okay, Weibel pallid bodies. So this, what these Weibel pallid bodies do, there is redistribution of P-selectin, okay, from Weibel pallid bodies. Okay, so Weibel pallid bodies does the redistribution of P-selectins. This is mediated by, remember, histamine and thromboxane. Histamine and thromboxane helps in the redistribution of P-selectins by the Weibel pallid bodies. These are the two most important facts given in the raw means. You need to remember this. Expression of selectins by interleukin 1 and interleukin 1 necrosis factor. So this was all about rolling. Now the leukocytes have rolled. We'll commence to the further action of M gone, R gone, then comes A. A is for adhesion. Adhesion, by definition, is firm attachment of leukocyte to endothelium. Firm attachment of leukocyte to endothelium called adhesion. You can write our definition in your own words. It's much fancier. Important is the molecules and the steps involved here. Okay, it's firm attachment of leukocyte to the endothelium. Here, these are mediated by molecules called, remember, integrins. Integrins, mediated by molecules called integrins. Rolling was by what? Selectins, E, P and L selectins. These integrins are again of two types. First one is beta 1 integrin. Okay, beta 1 integrin called BLA4 molecule. Then there is beta 2 integrin. Beta 2 integrin. Okay, these are CFA1 or MAC1 molecules. CFA1 or MAC1 molecules. Beta 1 or BLA4 molecules. This beta 1 integrin, they combine with VCAM1. Okay, this B2 integrin compound combine with ICAM1. VCAM1 and ICAM1, very important molecules. These both are present on where? Present on leukocytes. Both present on leukocytes. Okay, VCAM1 and ICAM1. VCAM1 with beta integrin and ICAM1 with beta 2 integrin. Okay, let's see how this works. Okay, so as always, this is the leukocyte. We have multinucleated structure. Okay, you've seen two molecules, beta 1 and beta 2. What are these beta 1 and beta 2? BLA4. Beta 2 is CFA1 or MAC1. Okay, and here on the endothelium we have endothelial cells as always. Here present the two molecules for interaction. Okay, for beta 1, what is this? VCAM1. For beta 2, what is this? ICAM1. Very simple interaction. Okay, beta 1, beta 2 on the leukocytes, VCAM1 and ICAM1 on the endothelium. Oh, sorry, pardon me, here a mistake, please forgive me. These two integrins are present on leukocytes. The VCAM and ICAM1 are on the endothelium. So mistake. Again, sorry for this. Okay. Moving on. Following this interaction between integrins and their combining molecules on the endothelium, this integrin, this leukocyte, what is this? This is our neutrophil. Okay, neutrophil finally decides to cross this layer. Okay, what is this layer crossing is called our fifth step. So sorry, so our fourth step. backward addition. This is our fourth step. T for transmigration. Okay, transmigration. Okay, this is the definition. Movement of leukocyte across the endothelium or the basement membrane. Okay, endothelium or the basement membrane. This transmigration is also known as diapedesis. In earlier years, we used to remember this diapedesis is the movement of neutrophils or leukocytes across the endothelial layer. This is the transmigration process, also called as diapedesis. It is movement of leukocytes across the endothelium or the basement membrane. Here there are some mediators. Okay, mediators are PECAM1 or CD31 receptor. PECAM1 or CD31 receptors. What it does? There is synthesis of collagenases or matrix metaboproteinases. MMPs. This is what is written in Robbins. Collagenases or matrix metaboproteinases, MMPs. The help of this, they cross the membrane. This crossing of membrane, transmigration, so called as diapedesis. Mediator is PECAM1 or CD31 receptor, which ultimately leads to our fifth adventure here. After MRA and T, there is C. C is for chemotaxis. Okay, this is the movement of leukocyte in the direction of a chemical stimuli. There is a chemical stimuli and there is movement of leukocyte in its direction towards the where our site of injury. The site of injury produces a chemical stimuli which is in the direction that there is movement of leukocyte. This is called chemotaxis. Chemo means chemical, taxis, taxi. We need taxi to move from one place to another. Chemotaxis, movement of leukocyte in the direction of chemical stimuli. From where it is coming? From the site of injury. Okay. This is mostly a unidirectional movement. And a targeted movement. It's mostly unidirectional and a targeted movement. Okay. You see some chemotactic mediators. Okay. These are of two types. Okay. First one is exogenous. Another one is endogenous. Okay. Exogenous, which is from the outside. These are bacterial cell wall products. For example, N-formyl methionine. N-formyl methionine, bacterial cell wall products, are exogenous chemical mediators. There is endogenous formed inside the body. There are three, remember: LTB4, leukotriene B4. Then there is C5A, complement system C5A, and interleukin 8. Okay, interleukin 8. You can remember this as LCI or LIC if you can choose. There is leukotriene TB4, IL8, and C5A. Very important fact, asked many times before. These are exogenous chemotactic mediators: LIC, LTB4, interleukin 8, and complement system C5A. Okay, see the mechanism here, okay, of chemotaxis. So here a ligand binds to the G protein coupled receptors, GPCRs. A ligand binds to the GPCRs, which leads to increased cytosolic calcium ions. Calcium ions increase, their level increase inside the cytoplasm. Increased cytoplasmic calcium ions leads to, remember, polymerization of actin. The most important point here, there is polymerization of actin, which leads to chemotaxis. This polymerization of actin process is used by many microorganisms, including Listeria, to cause infection. So, to the GPCRs, the ligand binds increased cytosolic calcium, leads to polymerization of actin, so leads to chemotaxis. This was about chemotaxis, the exogenous and endogenous factors, and the mechanism. From which we are going to our sixth step. After a C, there is O, which stands for opsonization. Opsonization. Okay, so opsonization is coating of a microbe. Okay, microbe is to be coated. It's coating of microbe so that it is easily recognized. Okay, so that it is easily recognized. Microbe here. Okay, this needs to be coated by something. Okay. Layer of coating around the microbe so that it could be easily recognized by what? Our neutrophils. Okay, these are mediated by very simple opsonins. Opsonization by opsonins. The very important opsonins here. First, remember the best opsonin. Going one by one. Best opsonin, FC, fragment of immunoglobulin G. Immunoglobulin G is involved in the antigen antibody interaction. This is FC fragment. This is FC fragment. Go and study the structure of immunoglobulins, then you are going to understand. FC fragment of IgG. Next is the complements. Okay, C3b, C4b, and C5b. Out of this, the best complement, C3b, 4b, and 5b. C3b is the best complement. And then there are serum proteins, which are, remember, fibrinogen and C-reactive proteins. C-reactive proteins. fibrinogen along with C-reactive protein is an important serum protein. Opsonin, best opsonin is Fc fragment of IgG, very frequently asked, remember this. Also this complements C3-4B5B, fibrinogen and C-reactive proteins. These coat around this microbe so that it is easily recognized by our leukocyte. We have reached our ultimate stage of cellular events. After O there is P. Finally there is P for phagocytosis. The ultimate purpose of the neutrophils, phagocytosis. Okay, what happens in phagocytosis? There is killing of the microbe. Killing of the microbe. This occurs in 3 steps. Okay, this occurs in 3 steps. First is the recognition and attachment. Okay, there is recognition and attachment of the neutrophils to the microbes after opsonization, which leads to the second step is engulfment. Neutrophils engulf the coated microbes. Finally, obviously, killing. Okay, killing of the microbe. So purpose here, after engulfment we do the killing of the microbe. Okay, now this recognition and attachment, okay, this is done by receptors. Some receptors are, remember, scavenger receptors. Then there are mannose receptors. Then there are receptors for opsonins. Scavenger receptors, mannose receptors, and receptors for opsonins are for recognition and attachment. Then, which will lead to the next step, that is this engulfment. Here in this engulfment, suppose this is the neutrophil leukocyte. Okay, these are the pseudopodia. Remember, pseudopodia used by the lymphocytes for engulfment, especially the neutrophils. These, okay, suppose this is the bacteria which is coated with opsonins, forms a smooth membrane out of here and engulfs. Okay, it engulfs the pseudopodia of neutrophils, engulfs this. Membrane is pinched off, okay, which contains our bacteria. Okay, contains our bacteria. This combines with, remember, here, what is this? Our all important lysosome with enzymes. Okay, this is lysosome with enzymes. What is this form? This is called phagosome. This is a phagosome. It's a pinched off vesicle. So phagosome, lysosome and phagosome, they combine here to form phagolysosome. Okay, these contain bacteria and lysosomal enzymes. Very simple. Place this bacteria engulfed in the phagosome. Lysosomal enzymes, they combine to phagolysosome, which contains the bacteria, which will be digested by a lysosomal enzyme. Okay, our engulfment is over after recognition attachment by receptors. Then we proceed to killing. Okay, now here killing is of two types. Okay, there is oxygen dependent killing and oxygen independent killing. Oxygen dependent and oxygen independent killing. The most important is oxygen dependent killing. Okay, how it happens we are going to see here. So listen, these are all important phagolysosome. Pardon me, I can't draw it properly. All important phagolysosome. Okay, we have here oxygen dependent killing, so we will obviously have oxygen. Okay, oxygen is converted to oxygen free radical. The enzyme here is NADPH oxidase. NADPH oxidase is the most important enzyme required here in this oxygen dependent killing. NADPH oxidase causes conversion of oxygen to oxygen free radical. Okay, this is a radical sign. Oxygen free radical. Oxygen free radical, we know the action of superoxide dismutase is converted to hydrogen peroxide. You have seen all this in Fenton's reaction in the discussion of free radical injury, how free radicals are induced. Superoxide dismutase adds an oxygen free radical to produce hydrogen peroxide, which then combines with chloride ion, okay, to form HOCl, hydrogen peroxychloride. This HOCl kills the bacteria. This HOCl kills the bacteria. So this is all about oxygen dependent killing. NADPH oxidase, the most important enzyme required here. From this we have seen that this H2O2 hydrogen peroxide chloride is a halide ion. H2O2 halide is the most effective bacterial killing system. The most effective bacterial killing system. H2O2 halide combination. Okay, so this was about oxygen dependent killing. The last one we are going to see is oxygen independent killing. Oxygen independent killing. Okay, this is a minor killing pathway. It's a minor killing pathway. Okay, so here the mediators are. Wait, the oxygen dependent pathway, major pathway. Okay, majority of killing is done by oxygen dependent pathway. And mediators here in oxygen independent pathway are lysozyme. Another L is lactoferrin. Okay, and then there are major basic proteins. These major basic proteins, remember 2 points, these are produced in eosinophils. These are produced in eosinophils. And these are have anti-parasitic effect. Produced in eosinophils and antiparasitic effects. Major basic proteins along with lysozyme and lactoferrin, 2 L's, and oxygen dependent killing. This was all about the killing process in phagocytosis. And last topic here I'm going to see is frustrated phagocytosis. phagocytosis. Okay, the name itself you can see this occurs when the cell encounters material which cannot be phagocytosed. Material which can't be phagocytosed. Material which can't be phagocytosed. For example, there are immune complexes bound to basement membrane. Immune complexes bound to basement membrane. Okay, as phagocytosis cannot occur, there occurs release of lysosomal enzymes to outside. Lysosomal enzymes from the phagolysosome, which was found here. Phagolysosome, where it was this phagolysosome, which contains the bacterial lysosomal enzymes. These lysosomal enzymes are released to the outside and causes damage to the outside substances, just tissues, which can also aggravate to some pretty disorders. Okay, this is all about frustrated phagocytosis. This was all about our today's discussion on acute inflammation. First, you've seen the definition of inflammation, then the after the definition of inflammation, we have seen the injury stimulus, then the four and then the added fifth feature of inflammation. Then there are the events, vascular events and cellular events of inflammation. With the addition, there is the rolling, margination, transmigration, phagocytosis, opsonization, everything. Then there is frustrated phagocytosis, the mediators, very important. Please do revise them, guys. Thanks for watching. I will catch you in the next one.